Radioactive iodine is the gold standard of choice when it comes to treating hypothyroidism. It is a definitive treatment. We have reported cure rates of between 94 and 98%, and it means that we're actually destroying that overactive thyroid tissue rather than trying to manage those thyroid hormones with medication over time. If we are just managing thyroid levels with medication over time, those overactive thyroid cells continue to grow and develop and can transform into a malignant carcinoma. Using radioactive iodine to destroy those cells is really ideal in that we're removing that risk away from the patient.
So nuclear medicine plays quite a vital role in the sense that it can both diagnose and treat hypothyroidism. It can assess through the scan the structure and the function of the thyroid gland. It can also show any ectopic tissue, which is thyroid tissue that's growing outside of the gland. This is really important in assessing whether the patient is suitable for this line of treatment. And then once we can assess that, we can tailor the dose based off the findings of the scan and administer the iodine. The other thing that sets us apart is the fact that we scan the animals to assess the structure and the function of the thyroid. So this uses quite advanced imaging equipment that's not available elsewhere. The fact that we're able to scan the cat at real time to see how the thyroid is functioning on the day of the therapy allows us to then decide whether to proceed with treatment if the cat is suitable, and then to titrate the dose, so reducing or increasing the amount of iodine that we're administering. While the investment is substantial in setting up an advanced medical imaging facility, we believe that this is completely worthwhile because we know that we're providing the best quality of care to our animals.
The isolation ward post-treatment is set up with the welfare of our patients in mind, providing substantial environmental enrichment to make their stay as comfortable as possible. While the potential for inducing iatrogenic hypothyroidism is rare and uncommon, certainly that potential does exist. We're really lucky here in that we have the ability to individually scan each of these patients and we're able to titrate their individual doses. That means that we are aiming really to prevent inducing hypothyroidism in these patients.
We can then use the scan morphology and uptake ratio to titrate the personalised and tailored dose for each cat that comes into our clinic. This then ensures the best long-term outcome for each patient.